And welcome back to the second part of Monday Special tonight. We are speaking to Vincent Ayalo, who is a survivor of prostate cancer. He'll share his story with us in just a few moments. He's sitting right across from me. And right next to him, we have Dr. Ahmed Komen, who is from the Aga Khan University Hospital, a specialist who will be telling us a little bit more about prostate cancer. Gentlemen, thank you so much for joining us on Monday Special tonight. Dr. Ari, can I start with you briefly? What is prostate cancer and what causes it?
Prostate cancer is basically, just to introduce this, is one of the common cancers that we see in male in this country and all over the world. And it's a disease of the elderly men, and it's a disease that affects the prostate gland. And prostate gland is a gland that sits just below the urinary bladder and just next to the rectum. And what happens is, with age and hormonal influence, the prostate gland proliferates or multiplies abnormally, and this results to what we call prostate cancer.
Anyone watching this who is 55 and above, a man, a lot of them, almost all of them, feel like they could be victims. It's who exactly can get affected?
Yeah, like I've mentioned, most cancers, actually, we do not know who will get it, but we know who is at risk of getting it. And the major risk of prostate cancer is actually age. And from what we know is that 80% of 80-year-olds actually have a risk of having this disease.
You said 80% of?
80% of 80-year-olds.
Okay. And what are the numbers in Kenya, doctor? How many men in Kenya suffer from prostate cancer? What are the numbers?
Quoting the statistics that is available out there is from Nairobi Cancer Registry, and it stands at 17%. This is statistics that was done from 2004 to 2008, and this is the only reliable data that we can actually quote and say. So 17%, yeah. All right.
You can quickly tell us the symptoms before we listen to Vincent. What are the symptoms?
Symptoms of prostate cancer, most times with the awareness that is ongoing, sometimes early disease are asymptomatic, and most patients go for other reasons to the hospital. And doctors, actually, when you are over 50, sometimes most doctors order for PSA. And once the PSA is actually a prostate-specific antigen. And once this test is done, and if it's found to be high, doctors normally suspect prostate cancer, and you undergo other tests and get a diagnosis. So sometimes it's asymptomatic. For patients who have advanced disease, the symptoms could be localized, whereby they have urinary symptoms, or if the disease is advanced, like Janet was mentioning here, it depends on the stage. Once the disease has gone to the bones and elsewhere, then patients tend to have symptoms like bony pains, leg weakness, and things like that.
A little later, I'll ask you about the treatment and how a lot of people feel about it being intrusive, etc. Vincent, thank you for being here. Tell us a little bit about your story. When were you diagnosed with prostate cancer, and how did you know that it was prostate cancer?
I thank the doctor for explaining what it is.
Yeah.
So I don't know, go back to there.
When were you diagnosed?
I was diagnosed in the year 2014, June.
Okay.
Now, how did I get diagnosed? I experienced problems in passing urine. It was very frequent, 5 times a night or 6 times a night, which appeared unusual. So I sought for assistance. That is when I was diagnosed to be having advanced prostate cancer.
Okay. Did you know what it was when you were diagnosed?
I did not know.
Okay.
I only knew I had problems in passing urine.
Okay.
Abnormally.
So what happened? You were diagnosed, and then what happened?
After diagnosis, I doubted the result. Because in the year 2006, when I wanted to go for insurance, they found I was having PSA, which it says is prostate specific agent, to be 9 in the year 2006. So in the year 2014, it came to 84.
Wow.
So I questioned myself, how does it jump from 9 to 84? So I seeked a second thought. I went to another test. After 1 week, it was 129. So it has jumped from 84 to 129 within a week.
Yeah. At that point, did you accept that something was wrong?
I just said, these results cannot be correct.
Again?
I seeked for a third test.
Wow.
It came to 148 after. So within that period, I saw there is a problem.
Okay. So you
then I seeked for help. The cost was prohibitive. I went to Kenyatta, I went to Nairobi Hospital, I went to Aga Khan. The cost of treatment was beyond my thinking.
So what did you do?
So I went screening, which was at the this is what you call Railway Club, organized by Faraja. I had no idea what Faraja is by that time. But after going there, they found out this is true. I had cancer.
Okay.
Then I went to the office and I seeked for help. I found a doctor who said they could help me if I could pay something as a deposit.
Okay.
I did that. Then they started treatment. The treatment was to be 35 sessions of radiotherapy. After finishing radiotherapy, the symptoms disappeared completely.
Okay.
Jumped from 148 to 0.01.
And now?
As I'm talking to you now, it is 0.05.
Okay. What?
I have no problem except side effects.
I see.
One of the side effects you're seeing, hot flashes. You can see me sweating and I'm drying it. That is a very common side effect. After every 10 minutes, no, after every hour, I sweat for about 15 minutes. Then I wipe it off and finished.
Okay.
The second side effect is I'm always using this stick because of pelvic bone pain. I cannot balance without this stick well because of the pain. The third side effect came later. This was due to if radiotherapy effect in my large intestine. I could now, instead of passing stools, I could pass clotted blood.
Okay.
This was scary. I was admitted at Aga Khan. They did check everything, and I'm on treatment.
Okay. Wow. I mean, doctor, I think it's a remarkable story of survival. Do you see that a lot? He said it took him 3 times before he was convinced. Do you see that a lot with patients?
We do, actually. It's difficult, actually, for any patient to accept that they have the word cancer. Actually, most people are scared to even be given that results, and they tend to seek second opinions, which is very common, and we encourage that, actually, because sometimes we know there could be lab errors and all that, which we encourage them to do that.
Just as a second opinion. A little bit about the tests that one undergoes. Tell me about them. Are they intrusive? I think that's one of the issues that I'm sure you'll tell me a lot of men are apprehensive about. Tell us a little bit about the test.
Very true, actually. But the initial step, the initial tests that we normally do in order to get diagnosis of prostate cancer are very simple, actually. It includes what Vincent has just mentioned. We do what you call PSA, which is a test that is done from drawing blood and taking it to the laboratory, and then you get the results. But once it's confirmed to be high, this is not the diagnosis of the cancer. So we end up actually running other tests to confirm that indeed this is cancer. And that is exactly probably what you are mentioning. And we know most men are actually scared of this. And
the tests are still intrusive, so to speak.
It is.
Very quickly, before we move on to treatment, I know he's talked about side effects of radiotherapy. Tell us a little bit about the numbers he was saying. 0.5, 0.1, 148. What should the readings be, and where should someone be concerned?
Yeah, indeed, once you've been diagnosed with prostate cancer, these readings actually tells us whether you are responding to treatment. Like Vincent had mentioned, the first test that he did, the PSA was very high. He mentioned something to do with over 100 PSA. This actually gives us an index of suspicion that it could be cancer. But the test that tells us that you have cancer is what we call prostate biopsy. So once we've confirmed with that and the patient has undergone treatment, then what we do with the PSA levels is actually to monitor whether the patient has responded to the treatment. And like he has mentioned, for it to go down like that, it's indeed encouraging, and it tells us that the patient has responded well to the treatment. All right, one or two more questions. Does it affect the treatment-wise? Does it affect the survivors or victims' ability in terms of image and sexuality? Yeah, indeed it does. It does, because we know.
What part does it affect?
Most of the treatments that we give for prostate cancer, be it radiotherapy, be it surgery, or even hormonal treatment that he was just mentioned that is causing his hot flashes, all causes actually impotence in a way. So it affects sexuality in that manner. Does it affect the ability to have children? It could be. It could. It could affect. Yeah.
How would one know that? Is it just? It's hard to say.
The initial discussions that we do have with patients before they undergo any of these treatments, the role of the doctor is actually to indeed say the disease extent and the kind of treatment that he's giving and the side effects of the treatment. So most of our patients, before they're given any of these treatments, they know that it affects them in one way or another. Yeah.
Vincent, as we speak, are you cancer-free?
I believe I am.
Okay.
Now, there's something I have to mention about treatment, which is important for everybody. The mental attitude is very important. I was responding well for my treatment was going on well until a time came that I had to go down. Why? I lost 3 relatives within a span of 5 months. I lost my granddaughter, my mom, and my sister in a span of 3 months.
Sorry about that.
And I never I could not respond to treatment at all. I went down until I got convinced that it is true, it is normal to be sick and to die. Is when that attitude of mind helped me to resume recovery. So it is important to have your mind settled before you can respond well to medication. That is important.
All right. I thank you so much for sharing your story. Wishing you all the very best as you continue. I'm sure by now you're an advocate. You mentioned to me during the break you're a self-appointed advocate, but I think you could help a lot of men.
Even where I am in the doctor's place, I'm now called Dr. Vincent Ayalo.
Okay, because of your knowledge.
Because I counsel patients who refuse to get treated. And when the Dr. Nayan calls me, Daktari, come and talk to the patients. I talk to them and they respond well. And they accept treatment.
That's good.
And I go in every house, my relatives, I talk to them. My children have now accepted that it can be done.
Thank you. Thank you for that. Thank you for your courage. Thank you for talking to us. All the very best. Keep being a champion and telling other people about it. And Doctor, thank you for shedding some light.
Before you can conclude, relatives like mine, friends, my immediate family, all these people are very important, the way they handle you when you're sick. The support they give you. Moral, finance, and otherwise. They are a very important group of people. And this, it should be applied to everybody.
For everyone.
And I'm very grateful for all of them.
And we're grateful to have you. Thank you so much, Doctor. Thank you as well for shedding some light on that. We'll be sharing some of your feedback a little in just a few moments, but stay with us. We'll be back after this short break.